Belinda and I work on a project called CAR T cells for the treatment of solid tumours in children. And CAR T cells are the patient's white blood cells that are modified in a very special and sophisticated way and then given back to the patient to go and kill the cancer. And so they're targeted against a particular molecule on the surface of the tumour cells, and hopefully they'll go and kill the tumour cells. Now, this is something that works in leukemia really quite well. Our project is to find a target in other tumours, bone tumours, brain tumours.
So we're focusing on T cells because their normal role is to keep you free from things that might attack you, viruses and bacteria. But you can modify their behaviour to attack a solid tumour cell, and that's what we're hoping to do.
Well, at the moment we're working in the lab to develop these T cells that can kill cancer, and we're working to prove that they do work. And then we have to do some studies to prove that they would be safe to give to people. But ultimately, the impact we're looking for is to conduct a clinical trial, to give these cells to real patients and see if they work and see if they're safe. For these first few years, the research is to get us to that point.
We don't know the best way to deliver these CAR T cells to a patient because we don't work with patients. Input from the clinical side of things really helps us design experiments that are going to test them properly and then hopefully apply them properly when they come to be put into patients later on.
So it's a big advantage to have the wards and the hospital and the clinic working side by side with the lab program. Support from charities for this sort of work is hugely important. Without such support, we won't have the resources to conduct all the experiments, to employ all the scientists, to buy the equipment and the reagents to make it all happen.
So the Kids Cancer Project have been hugely supportive of this project for a long time. We've really relied on their funding to allow us to progress through all the stages that we need to go from a basic lab idea and those experiments that we need to show that it's a likely therapy, right through to testing it in children in a clinical trial.
That sort of long-term support is hugely important for us.